We all know that our bones are made up of calcium, and calcium is the most alkaline substance. On a pH scale of 0 to 14, with 0 being the most acid substance like sulfuric acid, then calcium stands at 14 as the most alkaline substance on pH scale. The value of 7 on pH scale is neutral, and our blood pH is between 7.35 and 7.4 at any given time. If the blood pH goes beyond 7.4, then we suffer from alkalosis, and if the blood pH decreases below 7.35, then we suffer from acidosis. There are two organs which maintain the pH in our body, the lungs and the kidneys. When glucose is burned in our cells with the help of oxygen, carbon dioxide is given off, and it has to be get rid of through the lungs. If it is not, then the carbon dioxide builds up in the blood, and that creates a more acid environment. The next organ is our kidneys, which basically filters blood to remove acids and maintains the pH of blood. Nephrons filter the blood flowing through the tubules, and there is basically reabsorption area where the pH is monitored, and if the blood is acidic, then the acid is dropped into the tubules and it gets excreted through urine. On the contrary side, if the pH of the blood is alkaline, then the acid is reabsorbed from the tubules and into the blood. Food can be divided into two groups, alkaline foods and acidic foods. Some examples of alkaline foods will be lemon, dark leafy vegetables, fruits, millets, etc. The examples of acidic foods can be meat, refined sugars, cheese, caffeine, alcohol and tobacco, etc. To a certain extent our lungs and kidneys maintain pH of blood in our body, but when we excessively consume acid-forming foods, then even the lungs and kidneys become incapable of maintaining the desired level of pH in the body, and as a result the blood pH starts to drop from 7.35, and when the blood pH drops to 7.22, then our body takes the drastic step of pulling out calcium from our bones in the form of calcium phosphate, which is the most alkaline substance in our body, and uses the calcium to alkalize our blood. If this happens over long periods of time, then we risk developing conditions such as arthritis, cervical spondylosis, osteoporosis, and basically all bone-related diseases. The simplest way to avoid all these complications of developing bone-related diseases is to eat alkaline food and acid-forming foods in the ratio of 80% and 20%, so that our body naturally can maintain the normal blood pH value. The key to avoid most diseases is to maintain this balance of alkaline and acid-forming foods. Follow this simple rule and see the results for yourself. If you like this video and want more such informative videos, then please like, share and subscribe.